Hello, my name is David Craine, and I'm here today to talk about the caregiver perspective. Our story started as a cholangiocarcinoma caregiver for my wife in 2010. We were jolted into this new normal unexpectedly, as I'm sure most of you were. My wife Lisa was having an ultrasound for upper abdominal pain, and the doctor suspected that she had a gallbladder issue. When the doctor called and shared the shocking news that the test identified a large mass taking up 3/4 of her liver, we were caught completely off guard. She was only 46 years old and in good health. We were unsure of the future, and life seemed to be very fragile. I couldn't imagine my life without my high school sweetheart and the mother of our two sons. Our local gastroenterologist did not think this was cancerous, but I knew in my heart and gut that this was serious. Our first oncology opinion gave us no hope. We were told that Lisa was not eligible for a surgical resection and chemotherapy was our only option. The treatment would extend her life, but it would not be curative. After some research, we sought out a second opinion at the Cleveland Clinic. This is where we met Dr. John Fung. He restored our hope with the news that Lisa would be a surgical candidate. I often think what would have happened if we had never sought out a second opinion. For those caregivers that are just starting this journey, or for the ones already on this path, this will be one of the most difficult and challenging times of your life. It will affect the entire family physically, emotionally, and financially. This disease is extremely difficult and will require all of your heart and mind to be focused. Remember, do not lose faith. There are many patients, caregivers, medical professionals that are willing to assist you. In 2010, the landscape for bile duct cancer was bleak. There were no clinical trials, and the use of other GI chemotherapies were the only options, and they still remain the standard of care, but as I mentioned before, they are not curative. The Cholangiocarcinoma Foundation and their website is a great resource, but back then they were in the early stages of development in 2010. It felt like we had just been run over by a truck and rebounding would be challenging. Now, as we head into 2021, there are over 200 clinical trials, many of them targeted therapies for specific mutations, multiple support groups on social media, and the CCF is now a global organization advocating for clinical trials, pushing cutting-edge research, and bringing together experts in a collaborative venture and mentoring patients and caregivers around the globe. So as a long-term caregiver of a cholangiocarcinoma survivor, I would like to focus my presentation on some of the practical wisdom you can gain from being on this journey for a long time, and to share with you insights and resources that have worked for us and they may work for you. We have experienced multiple tumors, 8 in total, occurring 5 separate times. Treatments included 3 major surgeries, over 20 hours in the OR, 4 different chemo regimens, which did not stop the disease progression. It is extremely difficult to keep moving forward and to remain positive. Lisa had many critical health issues along the way, with obstacles and disappointments developing one after another. We just could not catch a break. But miraculously, we never completely lost hope. We continue to focus and explore different treatment modalities. Lisa's current health issues are associated with the cumulative effects of all of her treatments, but we remain so thankful for their effectiveness. As she likes to say, if a health issue isn't life-threatening, then it's not a big problem. When did we ever think we'd be thankful for chronic pain, neuropathy, and compression fractures? At one point, Lisa had endured a collapsed lung and she became septic. I thought at that point we were going to lose her. Thank goodness for our faith and for an amazing medical team. She also suffered from autoimmune chronic urticaria, which is severe hives and welts that cover the entire body, and they lasted for over a year. That was an especially difficult time as it was our 25th wedding anniversary. She was so sick that we really couldn't celebrate. We were going to renew our vows in Italy, but that didn't happen. This was a really low point and really hard to get over. She spent most days in bed, and I have come to realize that time is a real gift and that you need to cherish each and every day you have together. The next year, we spent our anniversary in a rented rowboat with a picnic lunch, and it was awesome. It wasn't Italy, but it didn't matter because she was here to celebrate it with me. And now, this June, we will be celebrating our 33rd wedding anniversary. My gratitude for each day, week, month, and year is beyond explanation. I would now like to go back to 2012 and continue sharing our journey. More new tumors, and the downward spiral continued. It was hard to really be hopeful, but fortunately, Dr. Kevin Stevens, a brilliant radiology oncologist from the Cleveland Clinic, wanted to try SBRT, stereotactic body radiation, which was not an approved treatment for cholangiocarcinoma at the time. It had never been used on a solid tumor in the hepatobiliary region. So we are so thankful that he was willing to think outside the guidelines of treatment options. Our insurance company felt this would not be a curative treatment because 2 liver resections had not stopped this cancer from reoccurring. So they were unable to approve the treatment. So weeks of frustrating calls to the insurance company from myself and our medical team finally paid off. The treatment was approved. You need to be diligent in your care for your loved one. You need to be their best advocate. It's a delicate balance to know when and how often to call the medical office. Be persistent, but not a pain. Never give up. You never know when an experimental treatment or new will work for you. In the last 10 years, many research and teaching institutions and doctors have begun to focus resources in the direction of cholangiocarcinoma, and we are thrilled. We are so thankful that pharmaceutical companies have taken an interest in bile duct cancers and are seeking out new drugs. To have the best possible outcome, you need to seek out these teams of multidisciplinary cholangiocarcinoma experts. You need to stay as positive as possible. Learn to celebrate small victories in this battle. Maybe the tumor marker went up, but not as much as the last time. Maybe the chemo treatment is not shrinking the tumors, but it's holding the cancer stable. These are many celebrations that you should recognize. When you focus on some of the positives, you will start to change your overall attitude and have an effect on the success of the patient's overall survival and quality of life. We had many friends and family throughout this journey who wanted updates on my wife's progress. I had contacts in my cell phone and Lisa's. I would be juggling one phone to another, sending out updates. It was becoming overwhelming. I would be cutting and pasting 40 or 50 messages to multiple people many times a day. It was extremely helpful and saved on time and sanity to set up a CaringBridge account. This free application can be used to journal a patient's journey and provide updates in one single post. Another helpful tool is to set up an online account with your medical institutions so that you can access your medical records, check on blood work, tumor markers, and schedule appointments and procedures. You will learn a new vocabulary, and you'll probably get an honorary medical certificate. Blood tests, tumor markers, ALT, AST, and liver panels will all become part of your jargon. And you need to figure out what's a normal reading for each test. That way you can help the patient's anxiety level and yours by watching and understanding the trends of the blood work. Other helpful tools can be found on the CCF website. There's a patient and caregiver blog, a place to print out an emergency medical card, and the opportunity to join the International Cholangiocarcinoma Patient Registry, where you share your information to help accelerate the discovery of new treatments. This is a great way to feel like you're contributing to research, and you are. Clinical trials are now part of the cholangiocarcinoma patient's treatment journey, and this is exciting news. Please do not be afraid of clinical trials. These trials are single drugs, combination therapies, immunotherapies, and targeted therapies. One of the first and most crucial steps is to have molecular profiling to identify any targetable mutations. Having biomarker testings will allow you to be potentially eligible for the newest treatments through clinical trials. If a sufficient tissue sample from your tumor cannot be secured, then the next best thing is a blood or liquid biopsy. Some of the latest treatment protocols center around targeting specific mutations, as opposed to chemotherapy, which affects good cells along with bad cells. The specialist map on the CCF website is an excellent resource to identify cholangiocarcinoma experts and institutions in your area. To ensure the best possible outcome, locate a doctor who has treated many cholangiocarcinoma patients and also is familiar with the current trials and treatments. Make sure your loved one's case is being presented to a multidisciplinary team or tumor board. This will bring all of the different medical disciplines together to decide on the best treatment. The internet is full of so-called miracle cures for cancer. If curing cancer was simple and easily available, we would have eliminated this disease by now. Be skeptical of these false promises. There are many individuals that will try to take advantage of people who are desperate for a cure. We liked an integrative approach, combining Eastern and Western medicine. Natural and homeopathic treatments can help strengthen the body, but eating a good balanced diet full of vegetables and lean sources of protein are an excellent complement to the patient's traditional therapies. We also made juices, took wheatgrass shots, and did acupuncture. I have yet to see anyone cured from cancer by strictly diet changes or natural remedies. Please remember that just because something worked for someone else doesn't mean it will work for you. You must always share any supplement or natural remedies with your medical team. Some of these natural remedies can have negative impacts on the efficacy of your treatment and may create a dangerous health issue. You will need to keep in mind this journey is a lot more like a marathon than a sprint. There will be good days and hopefully not many bad days. Do not lose hope. Stay focused on things you can control. Be there for your loved one. You need to be part nurse, part cheerleader, cook, and housekeeper. When you receive disappointing news about a scan or blood work or a clinical trial, sometimes there's really nothing you can say that will make the situation better. So the best thing to do is just to sit there, hold their hand, give them a hug, and sit in silence. But be there shows them that you care and that they're loved and supported. If their treatment protocol is not as effective as you both had hoped, this could be an opportunity to get a second or a third opinion on your treatment plans. When our two children were young, we were in the middle of our fight, and it was difficult to balance a full-time job, doing schoolwork, going to the grocery store, cooking, and cleaning the house. I felt like I needed to hold it together and present a normal life to our children while my mind went in a million directions trying to cope. If friends and family offer to help, let them. In the beginning, it doesn't seem to be difficult, but as time goes on, it can take a toll on the caregiver. Make sure you're getting enough sleep. Sometimes you need to just get an escape, even for a few minutes. Go for a walk, a run, a bike ride, read. Do something that is not cancer related. You also need to eat healthy to stay healthy. After Lisa's first liver resection, she spent a week in ICU and a week in a regular room in the hospital. And when we came home, I had lost almost 20 pounds, which obviously wasn't good for my health. As I mentioned earlier, we had 5 reoccurrences with a total of 8 tumors. And we feel the most important thing we did was to always stay on top of this disease. Receiving good scans and blood work is an awesome feeling, and it's tempting to think that you're done with this disease. But walking away from diligent follow-up can be dangerous. Cholangiocarcinoma has a high reoccurrence rate, so it's important to catch reoccurrences before tumors become too large or metastasize to other areas. We caught all of Lisa's occurrences early on and had either another surgery or a radiation treatment to treat those new tumors. We achieve this aggressive treatment plan by having blood work and tumor markers every couple of months and scans every 4 times a year, until last year when we moved to blood work every 12 weeks and scans every 6 months. This does not follow the NCI guidelines, but because of the high reoccurrence rate, we created this plan with our medical team. Remember that trust and open communication with your medical team is vital. So here's a recap of my suggestions. Make sure your loved one is seen by a multidisciplinary team of cholangiocarcinoma experts. Make sure their case is presented to the tumor board. Secure a second opinion. Lisa would not be here today without a second opinion. Make sure molecular profiling is done to identify biomarkers. Reach out for a caregiver mentor to support you. Set up a Caring Bridge account. Set up a medical access account. Have open and honest conversation with your children. Remember how technologically savvy they are, and they will be Googling cholangiocarcinoma. If you like social media, join the Facebook page for caregivers and patients. Say yes when help is offered from family and friends. Remember to not talk cancer 24 hours a day. Have some balance. Celebrate the small victories. Go to the CCF website and take advantage of all the incredible programming offered free to support patients and caregivers. Remember to laugh. Never give up, never lose hope, and always rely on your faith. It has been a very long journey, one that we are still traveling as I talk to you today. We stay as positive as we can, focusing on helping others travel the same path. We pray every day and ask God for one more cancer-free day tomorrow. And we never forget that He carries and supports us during the most difficult times of our lives if we let Him. It is my hope that there's something that I've shared with you today that will lighten your load, make it less difficult in this process, so that you someday could become no evidence of disease as well in your journey. Thank you.